I've been in practice for over 20 years here in Greenfield. It's the only place I've practiced. I came out of training and they needed a full-time pulmonologist here, and I went for it. I knew it was a great community. I'm different from a lot of doctors. I spend as much time as I need with each patient. I spend as much time as they need to tell me really what's going on. A lot of times it's not the one thing they came in to see me for. There's other things. And that does put me occasionally behind in the office, but my patients that know me and see me have no problem with that, because they know that when they get their turn with me, they'll have all the time they need. One of the favorite things that happens is when I have a patient who smokes and I talk to them about stopping, and they come back a few months later and they've stopped smoking, and I really feel like I've made a difference in their lives that way, because I know what happens if they don't stop smoking. And I also really enjoy younger patients, high school age, with asthma. Actually, I spend all the time talking about them about life in general, and obstacles they may come into or get in trouble with, and try to give them some insight as to what life's all about, that they may not listen to their parents. So I try to take the opportunity to do that. I'm most proud personally of my family. My wife Laura and I have been married for over 23 years. We have 2 high school daughters. They've grown up to be just wonderful people. They're very successful. I'm really proud of their academic achievements, but really, more importantly, just the quality, the character they've developed. I think my wife and I have done a great job getting them off to the real world soon. One very memorable part of my practice was the night of the State Fair collapse, the Sugarland concert. My whole family are fans, and my daughter and I were actually in the very front row. And when the stage collapsed, we actually were the last 2 to really avoid injury, which was very traumatic, obviously. On the other hand, it put me in a perfect place to be there to help out from a medical standpoint, and I was able to really save some lives that night. And I've done that obviously many times in my practice as a pulmonologist and critical care doctor, but I've never done that out in the field where you don't have the resources. That was really scary and very frustrating, because you don't have the resources. Here in the hospital, if you need something, the nurse is right there to hand it to you. But out there was no help, except for a lot of scared people with no training. So it's really, that was a memorable and actually, I guess, a proud moment where I really felt I could make a difference in a whole different way. I'm Dr. Rob Klinestiver. I'm a pulmonary critical care specialist with Northeast Medical Group, part of Hancock Physician Network. And I've been practicing here in Greenfield for over 20 years, and it's the best 20 years of my life.